Today I'm going to be performing a central line dressing change, and the first step that you're going to do for this is you're going to verify the order. You're going to check the patient's chart for their plan of care. Next, you're going to gather all your necessary supplies, and then you will knock on the door, come in, introduce yourself, ask the patient to verify themselves by two means, so name and date of birth. Next, you will provide for privacy, and you will raise the bed to a comfortable working height and lower the side rail. You will also give the patient a mask to wear because you don't want them breathing on the insertion site. If they can't wear a mask, you can have them look the opposite direction. And then next, you are going to perform your hand hygiene. And then you will put on your clean gloves. Okay, and now that we have those on, you're going to take your non-dominant hand and secure the catheter, and then you're going to use your dominant hand and you're going to pull back the edges of the bandage. This mannequin doesn't have one on, but I would pull it back towards the insertion site. And once you get that off, you will then take the bandage off and throw your clean gloves away. And during that time, you also will have a mask on. I just didn't put one on for videotaping, that way you could still hear me. And you're going to be assessing the insertion site, the location. You want to look at patency, you want to look at the skin characteristics, and you want to note any type of drainage or abnormal physical appearance as you're removing that bandage. So once you've done that, you're going to secure the placement of the catheter, and then you'll perform your hand hygiene. Once that's done, you can now open your sterile kit. And we're going to put on our sterile gloves first. And it is important to note that you would want to make sure that the trash can is close by, because you don't want to put the trash can in a place where you can't reach it. Oh. Okay, so once you have your sterile gloves on, you can throw this away. Next, you are going to bring this closer to you, and you are going to take your disinfecting agent, and you will then secure the catheter, and you're going to just scrub this at right angles for 30 seconds. And once you're done with that, you can throw it away. Then you're going to take your alcohol swab stick and you're going to clean down the catheter. And once you've done that, you can toss that. And then you will want to get your Share Prep. This is your protective wipe, so it helps the skin when the adhesive for the bandage is on it. So you're going to apply that around there, and you'll throw that away. And then next you're going to take your bandage, and since you want it to remain sterile, you're going to use your non-dominant hand to hold the back, and then peel off the front. So you'll remove that and lay that on there. And then at this point, you're not needing to be sterile anymore, so you're going to remove this hard edge. Okay, so once you've gotten that done, you can get rid of your sterile gloves. Then you will initial, date, and time the bandage, and you can tell the patient they can take their mask off. You can take yourself too. Then you'll raise the bed rail, and you will lower the patient into the lowest position. Don't want them falling out of the bed. So once that's there, you're gonna perform hand hygiene, and then you will leave and document the procedure and how the patient tolerated it.